You know what? It's 4 o'clock. I'd like to call the meeting to order. And I'd like to take a roll call. It's Jose Avila.
Gary Hintz.
Rick
Dale
Bearable.
Pittman. Dale Pittman.
Denise Decker.
Michael D'Amico.
Darcy Du Bois.
Great. Thank you.
Alderman Kirkowski is not able to join us today.
Oh, okay. Thank you so much. We do have a quorum, so we can go ahead with our meeting. First of all, I'd like to ask everyone, did you have a second to read the minutes? And do you have any corrections to the minutes? Any updates, any changes offhand?
Didn't see anything.
No?
No.
Okay. I'd like to entertain a motion then to approve the minutes as written.
A motion to approve the minutes.
Thank you.
I'll second.
Thank you so much. Any further discussion? No? All in favor, please say aye.
Aye.
Opposed? Abstentions? Thank you so much. The next item on the agenda here is the Health Department updates. A health officer report. Ms. Darcy?
Yes. Okay, so I did send out a brief report because it's pretty much all the same thing over and over every single day these days. But just I will give a COVID update outside of COVID. The main update is that Bender Beach is open. The beach water monitoring is happening, and we are posting advisories as needed. So there was an advisory last week, I believe, after all of the rain that we had, but it's back to normal test results and open. And I have heard that it is quite busy. Have not been down there myself yet, but so I also wanted to just talk about what we're doing related to COVID. So if you look at the data report, you can see our communicable disease numbers are very high. Those represent, when we say communicable disease investigations, that's basically every test result that we get in. So even when someone tests negative, it's still considered an investigation. We still update it in the system. We still record it, enter any data that we have about it. So we don't have thousands of cases, but we've had thousands of test results come in. So let me I wanted to pull up the and share the Oak Creek dashboard. I'm not sure if you've all seen it, but we're really fortunate to work with our IT department to develop a COVID dashboard for Oak Creek data, which is allowing us to share a lot more data.
Good.
So let me share my screen here. Okay, can you see the dashboard?
Oh,
Yes.
Yeah.
So this is updated 3 times a week, Mondays, Wednesdays, and Fridays, with updated data. So you can see we've got the number of cases, the number of individuals who are considered recovered and have been released from isolation, number of deaths. Hospitalized is the total number of people who have been hospitalized at any point during their illness. It's not current hospitalizations.
Okay.
Active cases. And then, it's just some demographics, age, gender, race, ethnicity. And then this, I'm just going to pop this one out so it gets a little bigger. So this graph is showing us kind of every day. The blue bars show us the total number of new cases each day. So you can see we range from 0 up to 9 has been our highest number in one day. One day says -1. That means that we had a positive test result that we realized. Actually, I think that was a person who moved to another jurisdiction. So when the jurisdiction changes, then it looks like we lost a case, which is kind of weird, but and then this the line that you can see is the 7-day average of new cases. So we look at the 7-day average because that's a little bit better estimate of kind of the data trends. If we look at each day, you can see it's up and down all over the place, but when we look at a 7-day average, it's a little bit of a smoother transition, and that's where we can kind of see some peaks in positive cases and where it's getting lower. So the last week we've had a significant uptick in new cases again. We had fewer the last couple of weeks. There's
Okay.
also this is just basically showing cumulative over time, the total number of positive test results. This is the same. And then this is census track showing just the Oak Creek. We have 5 census tracts here, and the circles represent, you know, the number of cases more or less in a census tract here in Oak Creek.
So it shows that we've had 1601.
No, that's
Or-
the census tract number.
Oh, thank you. Thank you.
Yeah,
Thank
I
you.
know.
You just said that too. I apologize.
That's okay. Yep. Yeah, that's the dashboard. I think we've had some really positive feedback. I know there was, you know, an interest in additional data from the community, and this has been a really, for me, easy. And I think once IT developed it, I think it's pretty easy for them to update it every Monday, Wednesday, and Friday as well.
Great.
One other, I just wanted to show you a couple of other graphs. Did my screen change to a different graph?
Yes.
Yes, it did.
Okay, thanks. It's hard for me to
Weekly
tell what I'm sharing.
positive and negative tests.
So this shows every week. The blue bars show the total number of negative tests that have come in that week, and the green positives. So you can see that, again, the number of positive cases has kind of ebbed and flowed, though this past week was higher than the last couple of weeks have been. We've also seen a decrease in negative tests. So we're seeing just a decrease in people getting tested overall. I'm not exactly sure what the reasoning for that is. It's hard to tell. One thing that we have seen over the past week, though, we also track the percent of positive tests. So in the past week, we've had 8% of people who were tested positive, excuse me. The past 3 weeks, we've had between 2 and 4%. So that tells us that more people are testing positive, but fewer people are getting tested. Again, it's really hard to say exactly what's behind that, but I do think that we are starting to see, you know, some more disease spread in the community based on the cases that we're seeing. The other thing I just wanted to highlight, and we saw this on the dashboard, but this is it looks a little different, but this is the cases by age range. So you can see at the bottom here, we have 0 to 19, 20 to 29.
Wow.
So the highest number of cases in Oak Creek is amongst that 20 to 29-year-old population, which we're hearing a lot about in the state and across the country as well.
Right.
You know, initially in the first, you know, in March and April, really the majority of cases were between 60 and above, and now we're seeing the majority of cases between 20 and 50. I have this other graph. This was a graph from earlier on. So this is just, again, March and April. You can see how it's kind of shifted. So now our higher bars are in the younger age range. So, you know, again, it's hard to say exactly what's causing that. I think, you know, anecdotally, what we're hearing is, you know, younger people, I think, are out and about more than older people. Older people know that they tend to be higher risk, and I think are still avoiding those gatherings and staying home. Younger people are back out. We've all heard the stories of, you know, cases connected to bars and parties and things like that. And we're hearing that amongst our Oak Creek residents who are testing positive as well in that age group. So just, you know, different choices that different age groups are making.
Right.
Let's see. So just one other data point, I don't have a graph to share, but we, at this point, 38% of our cases are connected to an outbreak situation. So that could be an outbreak in a workplace, in a long-term care facility. It also could be an outbreak connected to an event. So if we have a, you know, a gathering or something that yields a number of cases, that could be considered an outbreak as well. That is also interesting. It's also a change. Earlier in the pandemic, 60% of our cases were connected to an outbreak. So really what that means is that at this point, we are only able to identify kind of the source of infection for about 40% of our cases versus 60 earlier. So that also tells me that there's more kind of community spread. People don't always know where they're becoming exposed, which is also, you know, just another sign that there's still risk with being out in the community and with gathering with other people. Quick update on staffing. So the library will be reopening next week, which means that the library staff who have been here are being called back to work in the library. They'll be available just for a couple of hours to help But we are in the process of hiring additional staff. So we do have grant funding that we received from the state to hire staff to do contact tracing work. There'll be limited term employees. Right now, the funding is through the end of the year. So we are looking to hire 6 staff. We actually did interviews over the last couple of days and have some really good candidates, hoping that they'll be on board in the next 2 to 3 weeks to help us, because we definitely are in need of that help and are going to be, it's going to be a rough couple of weeks with losing the library staff. So hoping to have them on board soon. The school nurse staff are working very limited hours through the summer as well. So we do still have that support, which is really helpful. Our hope is that once we have the new staff on board and trained, that will free up some of the other health department staff to start thinking about doing some of our kind of normal public health work, which we haven't been able to do much of since March. But, you know, we do need to get back to doing things like immunizations and car seats and sharps containers and things like that. The community is certainly calling and looking for those services. So we will plan to resume at least some of those, hopefully by later this summer. We're still continue to work with our community partners. So I have been meeting very often and talking almost daily with both the public schools and the private schools here in Oak Creek, trying to work through plans for next year. As you can imagine, and you probably have heard or talked about yourselves, it's very complicated to think about what that looks like and how to best keep kids safe and provide them with a quality education. So, you know, there is no formal final plan yet, but we certainly are working very hard on that. Also still continue to work with businesses. So we've seen, you know, over 50 businesses here in Oak Creek that have been impacted by COVID, either had a positive employee or a positive customer or something like that. So we've worked with all of them and other businesses as well, as they call in and ask questions about, you know, how to keep their staff and employees safe. Largely, I think businesses are working really hard to try to do that here in Oak Creek and have been really good partners with us. The health department has also been incorporated into the city process for granting permits for events. So typically that's something that goes through the clerk and then maybe the streets department and some of the other departments that are impacted, but we've added some questions around how if they are planning to have an event, what type of precautions they'll be taking to help make it a little as safe as possible. So implementing, you know, the distancing and recommending masks and things like that. So now we're a part of that, involved in that process, and can work with organizers to help make those events, again, safer. I try to emphasize always that there is no safe way to gather, but, you know, there are things that we can do to make it safer. I think that was most of my updates. Are there any questions?
I just have one question. Well, one question, a couple of comments. Where are you? Are there still places in the area where people can get free testing?
Good question. Yes. So the 2 testing sites in the city of Milwaukee remain open. That's the UMOS on the south side, Chase in Oklahoma, and Custer Stadium on the north side. I don't have that address off the top of my head.
That's okay.
So those sites remain open. They are closed over the weekend for the 4th of July holiday, but for right now, they are staffed by the National Guard. And right now, the current plan is that the National Guard will continue to staff those sites through sometime in August. And then we are working, public health is working with the healthcare systems to try to make sure that that type of easy access to testing is maintained after the National Guard missions end, which they will, and the National Guard will go back to their, you know, other projects that they work on. But we know, and we've heard from customers and clients that they like that. They don't need an appointment. It's free. They can drive up anytime. It's quick and easy. And we know that if people have to call their doctor and make an appointment and go in, that we're going to see even less testing. So testing is something that we're really working on to make sure that that capacity is maintained for the, you know, the long run at this point.
Just another question. Now, when someone gets tested, are they able to get a hard copy of results saying that they were tested and it was negative?
Yeah, so we can provide that for Oak Creek residents.
Okay.
I should say, if they're tested by their healthcare system, they need to get that through their healthcare
Right. But the
provider.
free testing
Yes, but if
sites.
they're tested at one of the free testing sites, and they call us and go through the release process, to make sure that we're giving them to the right person, we can provide that. And we have done that for many people.
Right, because our nursing students, in order to go to clinical this summer, they have to have a COVID test done. And I did mention those sites in Milwaukee. I just wanted to check. So they would call their local health department.
Yes, where they live.
And get, okay.
Yep.
Secondly, I did participate in the weekend COVID testing.
Mm.
It was, I don't want to say it was fun, but it was very interesting. Went very, very smoothly. And I noticed that there was a huge peak in people tested, and the folks are real pleasant, real friendly, really efficient. I was able to call and get my result, and yes, I was negative, Mr. Baraboo. So
Yeah, that's good. So you're talking about the testing that was at Cudahy High School.
right, at Cudahy, yeah,
I
at
believe the
Cudahy.
first weekend in June that was.
Right,
and that,
right. It
yeah,
was.
that-
I
it
went
was
to
a-
Saturday.
It was a 3-day testing, and they tested, I believe it was 640 people over those 3 days. Many Oak Creek residents. And you're right, yeah, we saw more tests that week than probably any other week that we've seen. So definitely we know that people want that easy, accessible testing. So yeah, thanks for sharing your experience.
Also, too, I did hear in one of the updates, I think it's from the city of Milwaukee, that the state, or I think that the COVID testing, as you said, was going to continue till the end of August. And after that, I guess there was a comment that the governor would have to ask for more extension on the funding from the federal government.
Yeah, for the National Guard. That's my understanding as well, that if the
Okay.
National Guard, we're going to keep providing that testing. Yes, the federal government, I guess, would have to approve it. I don't understand all of the military processes, but that's also what I heard.
But I did also want to comment that, I get around a lot in the neighborhood and to all these different stores, and they're really trying their best. They're really
Good.
trying their best they're wearing their masks. They've got their sanitizers ready for everyone. And they always make sure when I go to Arby's or whatever, they always put their gloves on, and they're very pleasant, and it's very casual to them. I've never seen anyone, be a curmudgeon about it. They've always said, yeah, hello. And you can see the smile under their mask because, they're just getting used to it now. So whatever you're doing, keep doing it because they're following through. At Myers, when I go there, they've got hand sanitizer everywhere, and they're all wearing masks, and they do encourage the social distancing, and they're announcing it every 5 minutes on their speaker, please maintain social distancing. So whatever you guys are doing, Dale and the gang, just keep doing it because it's people are listening. People don't always wear their mask, but more and more of us are wearing masks.
Yeah.
So I appreciate all that you guys are doing to keep us safe in the community.
Good. And I haven't been out in the community at all, so I appreciate your perspective.
I get around.
Yeah.
I didn't mean to monopolize the comments. Anyone else comments, please? Am I the only one that gets around? Okay. Anything else on the health department update, Darcy?
Nope, that's all that I had.
Okay. And then Mr. Dale, the environmental health updates. Well, you know what, Dale, you're muted, so if you can unmute yourself.
Here we go. All
Thank
right,
you, sir.
there we go. Yeah, I started doing inspections again, mainly just pool inspections for the month of June, and then that'll take me through at least half of July, and then I'll be able to get out there and start some food inspections. So still, I'm up to date on the food inspection, so I'm not too concerned there. But as far as it was renewal time too, because other years the renewal due date was June 30th. But we extended that through September 30th. But we've had about 80% of our licenses have been renewed already. So, and I do expect all, probably other than maybe like 2 or 3 that may not renew, but all of them will eventually renew. So,
okay.
other than that, yeah. not much else to report there.
Okay, great. Anybody comments, questions, anyone?
Yeah, I was gonna ask if many businesses have closed their doors.
Well, just the Blue Agave Blue over there on 27th Street. They're the only
Oh,
ones
yeah.
that I know of that haven't. Yeah, they took down the sign, so there's a for sale sign. That's the only one.
Yeah, I noticed that. Anybody else comments? Denise, Rick, Gary,
No.
Mr. Webinar? No, no comments. Old business. Any old business?
Nope.
Any new business? Nope. Okay. Super duper. Anybody else comments? Again, I'd like to thank Darcy and the gang. I should say Darcy and the staff, excuse me. Darcy and the staff, you guys are doing wonderful. Thank you so much for getting the word out. I'll definitely be looking at the dashboard to get the updates. Now, do you know what particular by a certain time it's updated each day?
It's updated Mondays, Wednesdays, and Fridays. I believe it's usually in the morning.
In the morning?
But
Okay.
I pull the data and then I send it to the IT, and so it depends a little bit on
So
our
by
schedules.
the end of the day then.
But yeah, it
Okay.
is updated Mondays. It won't be updated tomorrow. We updated today instead of tomorrow because tomorrow is a city holiday. And we are still posting daily updates on Facebook, on our social media and website as well. Not daily, I'm sorry. The same Monday, Wednesday, Friday. We transitioned to that schedule for all of our data updates.
Okay. But no, thanks again for really, really, encouraging businesses and such to really stick to it because they're really trying hard. I know Farm and Fleet, they've got like the cleanest bathroom in town, the one on Ross in there, and they work really hard on doing all that stuff. And they've got all kinds of, things that they're doing. So, thank you for that and keep doing it. And I always thank them to say, thank you for doing that. Thank you for having hand sanitizer because I'm addicted to it. So, but anybody else comments, questions? Okay,
No,
so go
Well, I
ahead.
just extend the same compliment to you and your staff, Darcy. You've done a nice
you.
job, both with the businesses and then keeping the public informed on Facebook and just so people know. I think it's helpful and most people are trying to follow what you recommend. So,
Right.
Thanks.
So the last thing then is our next meeting is scheduled for Thursday, September 3rd at 4 p.m. I'm going to be teaching a class that day until 5:30, but I'm going to see if I can sneak away for the meeting.
Okay.
And I don't know if we're going to continue in Zoom or we'll probably be in person by then.
Yeah, I mean, we are going to transition back to at least having the option for in-person, and I'm not sure if there'll be a Zoom option as well. So,
Okay.
if there's feedback about that, you guys can let me know. Otherwise, we will be using the larger room. So we've got the multi-purpose room, the room that's kind of all in glass in the City Hall, excuse me. So we will be using that room so that we can have the physical distancing that we need if we're in person.
Great. Well, there being no further business before the board, I'd like to entertain a motion that we adjourn.
I'll entertain that motion.
Okay, a second. Thanks, Gary.
I'll second it.
Second. Okay, all in favor?
Aye.
Opposed? Abstentions? Nice to see you, Gary. Abstentions? No? Super
I don't know.
duper. Thanks.
Am I even on video?
No.
Well, what's your name? But it's nice to hear you, though. It's nice to hear you.
You haven't killed me yet, so.
Yeah. All right. Well, thanks everybody, and appreciate all your time and everything that you're all doing. And Dr. D'Amico, thank you for all that you do in your practice with your patients. And Denise, all that you do. Everybody for all that you guys are doing in your work. You guys are heroes. Remember that. You're all
too,
heroes.
Jose. You're doing the work too.
All right. You guys take care and have a great holiday weekend.
Everybody have a good 4th.
All righty.
Bye-bye.
Bye.
Bye-bye.
Bye.
Bye.